everyone, and welcome. Welcome to our elder abuse prevention session for the month of November. I'm Antoinette Warren, the founder and CEO of Warren Publishing Group, which is a senior advocacy alliance, and we are celebrating our 9th year of successful advocacy. Praise the Lord. So, one of our big concerns at Warren Publishing Group is elder abuse, and it will continue to always be in the front of our advocacy because elder abuse is running rapid everywhere, especially in Alameda County. So, since August, we have been having presentations on elder abuse prevention. So in August, we had the effects and prevention of elder abuse. In September, we had elder abuse prevention training presented by the Alameda County Adult Protective Services. In October, we had financial abuse and estate planning. We also had in October a demonstration on the ease and simplicity of setting up your personal will and living trust. And today, we are presenting a very important issue regarding healthcare. If you have healthcare, then you don't have to slip into that area of elder abuse. And so I am extremely honored that Alameda County Care Alliance has been our co-presenters since August with this series. And also a co-presenter has been the National Coalition of 100 Black Women at the San Francisco chapter. So today we are blessed to have Reverend Cynthia Carter Perliot, and she is the co-founder and executive director of the Alameda County Care Alliance Collaborative. And she's going to be speaking regarding the program and how the well-being of individuals with serious illness, including their caregivers, is a very critical topic. And I will say that ACCAC is a faith-based program in partnership with local, clinical, academic, and community organizations, engaging 25 based organizations and their pastors in Alameda and Contra Costa counties of Northern California. Reverend Cynthia is also the creator of I Choose to Prepare, a dramatic and creative approach to care, advanced care planning, soliciting youth involvement through spoken word, dance, and the visual arts. So before Reverend Cynthia comes, I will say that if you have any questions, you can type them in the chat on your Zoom. And at the end of this presentation, Reverend Cynthia will receive your questions. Thank you so much for your attendance. And now, please, Reverend Cynthia Carter Perliot.
Thank you so much, Antoinette Warren, for that wonderful, warm welcome. And it's just a joy to see and greet all of you. Some of you I see, some of you I see your names, but we are just grateful that you are with us today. Special thanks to Antoinette and all her hard work for bringing us together in this forum. And it's been a lot of fun partnering and bringing this important information around elder abuse and just all the wonderful resources that are out there to support people that are caregivers, to people that are advanced age and needing support from their community. And when we think of community, we are very proud of the faith-based community because there's so much that our churches and faith-based organizations have to offer. So with that being said, I am going to bring up my slide presentation and we'll get started in just a moment. All right, almost there. So can you see the presentation? Just nod your head or wave or something, let me know you can see it. All right, wonderful. So as Antoinette said, our organization is the Alameda County Care Alliance Collaborative. We are an organization that really believes in the power of the faith-based movement. And I think all of you would agree that when it comes to aging and advanced illness and health, we need all the help that we can get. I, like many of you, have a caregiver. I was a caregiver for my father and for my eldest brother. And caregiving is a tough job. It really is. And unfortunately, there are not enough organizations that are lifting up the banner, if you will, for caregivers and all that they do to walk alongside those that they love, those that they are caring for. So we believe that there needs to be more hands on deck. And so we are very grateful and humble and proud of our care navigators. This program raises up people that have a passion for caring for other folks that are aging and dealing with serious illness and their caregivers. And we are a program, as Antoinette said, that promotes the well-being of individuals that are dealing with advanced illness and their caregivers. So what you see here is a slide of many of our care navigators, care volunteers, care ministers, and participants in our program. And so this is a wonderful group of committed leaders across not only Alameda County, but Contra Costa. And now we're serving also San Francisco County. So we're really blessed and grateful for God smiling upon us and the growth of our work. So what I want to do now is set some context for the work that we do. And this model, this vision really seeks to increase and literally build infrastructure from the health systems to the community and from the community to the health system. So for an example, when individuals are in the hospital, they are discharged from the hospital to go home. And the truth is, many times people don't know who they can trust in terms of accessing resources, be it support as caregivers, be it support for addressing advanced care planning, be it support for what resources in the community that are honest and trustworthy and organizations of integrity. And that's where we come in. The Alameda County Care Alliance Collaborative really seeks out and vets organizations and making sure that when we make referrals to our precious participants, who are caregivers, of course, and people that have advanced illness, we know that they're going to be in good hands. So what we seek to do is bridge the gap between the health system and community. We want to address disparities and advance equity. What do I mean by addressing disparities and advancing equity? The reality is unfortunately, we as African Americans and people of color have known forever that we as people of color do not get oftentimes the support that we need, the resources that we need from the health systems. We have a lot of reasons to have a lack of trust and distrust for health systems. And so it's important that we as an organization and as a community build relationships with health systems so that we are acknowledged and really get the kind of support and care that we need. And then advancing equity, fairness, giving our people the tools that they can use to communicate with their primary care physicians and other clinicians. And so this organization seeks to really assist all people. Certainly, it doesn't matter your ethnicity. You don't have to be a person of color. You don't have to be even a person of spirituality or religiosity. But you do need to be an individual that's dealing with an advanced illness and a caregiver. But we really are about also how do we support our own people and people of color. So this is a rather busy slide, but it gives you a lot of information, and I want to try to touch up on a lot of these important points. We refer to this work as true person-centered care. What do I mean by that? Many of you that are already involved in health system work, via as home health aides, as nurses, physicians, social workers, may already have heard the terms person-centered care and health system. We refer to true person-centered care as when you acknowledge the holistic care of individuals. So what do we mean by holistic? We mean their body, their mind, their spirit, their soul. All of those components make up who we are as human beings. And so we focus on not just the care that is needed for the body and for the mind. Emotional support obviously is very important also, but we also focus on the spiritual if that's important to an individual. Now, our care navigators are amazing people. These are trusted, well-respected individuals. Many and most of our care navigators come from our ACCA churches that are partners, and you'll hear more about our partnerships. We're always looking for new and interested faith-based organizations that want to partner with us. So this is not an isolated group. We are here for the community. So we want to then identify through the help of the pastoral support and leadership, who are these respected individuals in your church that, oh, by the way, have a passion for people, have a passion for supporting those that are dealing with health challenges in your congregation, but also being open to supporting those that are within our community. And so these individuals do not have to be clinicians. They don't have to have clinical backgrounds, although some of our team do have clinical backgrounds. I have almost 30 years of involvement in palliative care and hospice care as a marketing person, as a trainer, and as an educator. Again, you don't have to have that kind of background, but what we find is that many of our care navigators are people that have been past caregivers. And so they recognize and are very acquainted with how challenging the caregiver role can be. And they're really, as we often say, responding to a calling. Oh yes, a calling, a response to really walking alongside people that are dealing with serious illness, advanced illness, and even end of life. And so our navigators form trusted relationships with the participant. So let's face it, folks, we're talking about walking alongside people that are dealing with various challenges in life. It's important to know that you can trust folks. And so we have a 5 cornerstone approach that really focuses on 4 and actually 5 key areas. So I'll talk about the 5 cornerstones. But before I talk about that, the work of the care navigators is really to listen, to understand the participant's story. And that includes their life as a whole individual. And so our navigators are thoroughly trained to be good listeners so that their participants can engage in storytelling and story listening. Then our navigators, as a result of listening to the participants thoroughly, then they provide support services as it relates to referrals and as well as empowerment, and providing tools and training. So we'll talk more about that on another slide. I want to highlight the fact that we are about understanding the goals of the participants. So when I talk about participants, once again, I'm talking about caregivers, and I'm talking about people that are dealing with chronic illnesses and serious illnesses. And so we understand by listening what their goals are, tremendously important. So this true person-centered care is not about us. It's not about your physician. It's not even about the healthcare system, but it is about you. And so we're here to engage in those conversations, in those listening opportunities, and then we assess what the needs are based on what we hear. I want to call out this last piece. Our navigators say it's a blessing to serve. Generally, we've heard nothing but the fact that these individuals, our care navigators, are served with gratitude to be involved in such important work and an opportunity to give back to community. They find that the work is rewarding, and we do surveys annually with our navigators. We reported no burnout, and we really try to also listen to what the needs of our care navigators are as well. So I just want to highlight really quickly and call out advanced illness care disparities among African Americans. This is a busy slide also. What you see at the bottom is a lot of the research data that we engage in and have engaged in from the beginning of our work and even presently. And it's really charted out in this one orange box that has the pluses and minuses. And I want to draw your attention to that. So there is a disproportionate burden in advanced illness for people of color, non-Hispanic whites. There is a heavy prevalence of advanced illness. We know that there have been health disparities in our communities forever, be it heart disease, be it liver disease, lung disease, cancers, advanced illnesses as it relates to dementia. And that's just naming a few. And then our people typically have later detection of the disease. We tend to care for our loved ones in the home setting, but we've also seen there is a huge amount of unmet needs, both physical, spiritual, and in the identifying of tangible resources. I mentioned earlier that there's a large amount of medical mistrust in our communities, understandably. I don't think I need to go over the history of the Tuskegee Project, which our community still is reverberating through what happened with the US government and the health systems in that period of time. And then there's a preference for life-sustaining therapies amongst our community. Many times that's because we don't understand or have been thoroughly informed of what our options are. We know that we don't trust the system, so we want pretty much, quote unquote, everything we can get. When it comes to pain and symptom management, we don't get what we deserve there. Many of our people suffer silently because the medical system does not give them what they really need and deserve to manage their pain and symptoms. And then you see the other points there. There's not enough completion of advanced care planning, the PULSed. These are areas that our navigators are thoroughly trained in to respond to in their home setting. Pre-COVID, we certainly were having home visits. Presently, all our phone visits and virtual visits as well. Access to palliative care and hospice, once again, we have less of access because we don't really understand the benefits to us as a community. And we typically don't get the care concordance that we deserve. So unfortunately, we see a lot more suffering in our communities because we have less access to care, and we really don't get the care that really meets our personal needs. So I hope I've set the stage for you to have a sense that people of color, and particularly African Americans, need the support that this kind of program, through the support of our care navigators, can bring to congregants, but also to the broader community. So I'm going to go through these next slides pretty quickly. This slide really speaks to how we help bridge the gap that I referred to earlier. So this movement was birthed and born and developed in the faith-based African American community. We started out with about 5 very strong churches. We've now grown to about 25. We actually have more than that, but we have about 25 churches that regularly engage with us in some form of needing support and supporting this work, working with pastors and leaders and people that are very committed to this work. So we were birthed and born in the African American community, and we reached out to partner with Kaiser Permanente and other health systems. UC Davis School of Nursing, we reached out to UC Davis School of Nursing to be our research and evaluation partner. And we also reached out to the Public Health Institute, which is a 55-plus-year-old organization, which is our fiscal sponsor. We are our own 501c3, but we wanted to have that support from a large respected organization to help us with grants and contracts and all that sort of thing. So again, this is the foundation of our amazing collaborative that we really give God the praise for, that has blessed us to be in this work now a little over, actually 6.5, 7 years. So what you see here in this slide really gives you a picture of what we do. The Alameda Care Alliance Advanced Illness Care Program focuses on these 5 cornerstones that you heard me speak about earlier: spiritual needs, health needs, planning for advanced care, social needs, and caregiving needs. In a series of between 5 to 12 visits, again, pre COVID, we were in the home setting and on the phone with our participants. Now, in this COVID environment, all of our care support is on the phone or virtual, be it via FaceTime if that's agreeable with the participant, or via Zoom. And our navigators then work with participants that have advanced illnesses and their caregivers for a 6-month period. And there are individuals that don't need a full 6 months. Some may say, I just really need support, Reverend Cynthia, with social needs. As an example, getting meals prepared, or issues, I have challenges with my housing support, and I need help there from your navigator team. I also want support with advanced care planning, and basically through what we call a personal advanced illness care plan. So it's personalized for each individual, working through these 5 cornerstones, which, oh, by the way, focuses again on that holistic support. We're able to respond to what those needs and priorities are for each individual that is enrolled in our program. So again, we identify the needs through these cornerstones, the holistic approach, providing trusted referrals and resources, really, and then to empower individuals so that they know they're not alone, that they have support even within their community. And once they graduate, if you will, from the program, they have tools that we've left with them that they can then continue to use. And oh, by the way, they can continue working with us if indeed they see that they need more support. Very quickly, this just gives you a lot of information about, over the years, the number of individuals that we've serviced and supported. So we've actually enrolled. We need to get permission from people because we really apply very stringently the HIPAA laws of confidentiality. So we have over 1,200 people that have signed up and enrolled in our program through consent. We have about 11,000 plus, actually, it's even higher than that now, of individuals that we've touched through the program, through working with congregations, the community, presentations, table talks, so many ways that we've been able to inform and educate community around advanced illness, advanced care planning, palliative care, hospice care, you name it. We've been prepared and have been doing that work now, again, over 6.5, 7 years. In 2019, we consented about 231 individuals, about 50% caregivers, and 50% of those are persons that have advanced illness. And we received over 81% that have agreed to be a part of the evaluation. So evaluation allows us, again, through our work with UC Davis School of Nursing and Research, to really understand if we are meeting the needs of these individuals, but also how we can continue to improve the program. What you see here is one of the programs that Antoinette referred to in our introduction, the I Choose to Prepare program. We've actually had this event for a number of years now. Of course, now in COVID, we won't be having it in the physical, but we do in various ways continue to engage community, faith leaders, pastors, to think about what they would want in the event that they couldn't speak for themselves, but to do in a way that is positive, that's uplifting, because the truth of this matter is, folks, this really is about empowering you, to empower you and your voice so that you can say what you want and don't want. And that's tremendously important for us as a community. And so what you see here is some of the actual modern dance to music and song around this important subject matter. We had opportunity to share it in a national celebration called Share Care Awards in Atlanta, Georgia. You see Pastor Jones and Alexis Owens and Dr. Janice Bell representing us in Atlanta. And of course, in the very center, we have several videos you can access via YouTube, and just put ACCA in the YouTube link, and you should be able to pull up many of the YouTube videos that we've developed from our care navigators and from our program as a whole. Again, some slides from our We have an annual caregiver recognition celebration. And so we really believe in honoring our caregivers. Being a caregiver, as many of you have been, you know it feels very lonely. It can be a very lonely job. You feel like you're out there alone. We seek to lift up caregivers and cause them to know how important they are. And we acknowledge them in very special ways, special dinner, special music, special word from our pastor leaders. So it's just a day of wonderful celebration. This year, again, because of COVID, we won't be having our celebration this November. November is National Caregiver Month, but we will be sending out special cards and greetings to our caregivers to encourage them. Let them know they are not alone. We also published and developed a CD, and I don't see that CD on these slides, so that's my bad. We'll have to make sure that you have the opportunity to be aware that we do have CDs that we give away for free to our caregivers. Our churches, members, and people many times will make contributions so that we can keep this free gift to support and encourage our caregivers. If any of you are interested in receiving that free CD, please make sure that you put that in the chat and or email me. It might even be better to send an email so that we can get your address and so forth and send you one of those CDs. This is the program from the Caregiver Recognition Celebration from just last year. We held the celebration last year at Beth Eden Baptist Church in East Oakland. I'm sorry, that's actually West Oakland. Yes. This is a conference that we attended and participated on a national level. We've been blessed to have presentations on both the local, the regional, and national levels. You see myself and Dr. Jessica Zitter. Dr. Jessica Zitter is a nationally known physician that is another homegrown Oakland doctor from the Bay Area. And we have an amazing partnership with Dr. Jessica Zitter to help churches and faith leaders discuss making decisions before they actually encounter the emergency room or the ICU. There's also Pastor Corey Kennard from Detroit, Michigan, who's also a very strong and leading healthcare advocate and pastor out of Detroit, Michigan. You see our program manager, Val Steinmetz, and Reverend Dr. Barbara Galloway Lee at the bottom, attending a conference we had in Sacramento a few years ago. So we have been representing the Bay Area for a number of years now, and we're thrilled to do so. And it's just a blessing to be able to share this information with all of you today. So what we have here are some responses from the people that we served. And participant voices is how we call it out. So here's a comment. Now we can go in there and already have a plan. We don't have to wait for the doctor to tell us the plan. You don't have to just listen to what the doctor says. You have a say. I absolutely love this comment that's come from one of our persons needing care. And what they're saying is that they have felt empowered to understand through the support of our Care Navigator team that they can have a voice in their care. That's what we want. We want to empower people to know that they can speak up and share with the doctor what's important to them, and therefore really get the kind of care that they so richly deserve. I'll read another one here. Spiritual support. The pastor came over at the end and he prayed with her. He prayed with all of us. You can rely on the Lord for strength because you're going to break. Eventually, you're going to break. This was a comment from one of our caregivers. Another caregiver said, this program has been a tremendous blessing to those who are in need. So some of the comments that we've received, we're really grateful for the positivity and the input that we've received from those that we've had the blessing to serve. Very quickly, I just want to point out that, again, our work is with the community. We also, as we showed and shared in the slide earlier, partner with health systems. So presently, we're continuing to develop and strengthen these relationships with healthcare systems, policymakers, and insurers. And so we have a current partnership with Kaiser Permanente Oakland, where we are developing a pilot model, working with primary care physicians and their patients to our care navigators to provide special support through our program and we're very excited about these opportunities. We also have a present pilot opportunity with Lifelong and also Alameda Health System, which of course is Highland Hospital, San Leandro Hospital, and that particular collaboration within Alameda Health Systems. So all of these partnerships really deepen our work and help the broader community to know that there is an organization embedded in your community that is here to assist you. And oh, by the way, it is for free. We charge nothing for our services. We simply need the consent of the individual to work alongside. I pointed out a couple slides because of this COVID period that we're in. And I think all of you on this call probably are well aware that there's a disproportionate impact of COVID-19 in communities of color. African Americans and Latinx communities have a very high percentage of confirmed cases of COVID, and we're dying at higher rates. And so what we have found is the work of our ACCA Care Navigator supported efforts are tremendously helpful in this period of time, because we have established those trusted relationships, and we continue to do so to walk alongside our people, our community, even in this COVID-19 period. We talked about earlier advancing disparities. Again, continuing to build those trusted relationships are so tremendously important. We're going to continue to do our best with your word of mouth spreading about this program and our continued just care and grace to do this work to support people that have advanced illness and their caregivers. And one of my final slides before we have Q&A. So what we have found through this work in this period of time that we've been able to work closely with our participants, we're seeing a completion rates of advanced care planning that's higher, greater than 50% compared to the national rates. And we're often asked, how is it that we find people of color, particularly African Americans, through your program are completing advanced directives? And I always go back to the fact that first and foremost, we take the time to build trusted relationships through storytelling, story listening to our participants. So of course, when you're in the doctor's office, our care team supervisor, Mary Spencer Dockery, says it's 15 minutes of fame. You don't have a lot of time when you're talking to your primary care physician, but our navigators take their time to listen, to hear, and then to answer questions that people have around advanced care planning. Let's face it, it is a process and it takes time and trust. And in doing so, our care navigators are able to do just that. And we're seeing amazing results, particularly through the use of our own care planning workbook. I'll show that to you in a minute. We do encourage people to tell their story. So our outcomes have been pretty amazing, some of which I shared in the one slide through our program reach efforts. We've had obviously many opportunities, and we continue to seek out ways to help our community and other communities in addressing their needs. Participant satisfaction has been very high and continues to be very high. And advanced care planning, as I mentioned, is also higher, much higher, really over 2 times higher than the national average. So this is our care planning workbook that we've developed through focus groups with our navigators, pastors, and ACCA leadership. And it really is a 3-fold process: thinking, planning, and doing. Our care navigators walk through the process given the current stage of the participant. And so we've, again, through true person-centered approach, speak about what's important to that individual and get right to it through this care planning workbook. We have a workbook for caregivers that we've developed also. And so it's a supportive guide, and it really also focuses on building a team. Caregivers, you cannot do this alone. I can't further emphasize that enough. You need a team of people, be it family, friends, your church, the community, the ACCA, to really be able to take care of yourself as well as the loving person you're caring for. And so our navigators walk through this caregiver workbook with you, and we provide this also for free. So I want to thank you for this time and this opportunity. Our faith leaders, thank you for participating in this call. Thank you for being interested to hear the work of the Alameda County Care Alliance Collaborative. And we are a testament, and working together, all of us really can make a difference for ourselves, our family, your churches, as well as your community. And so we've left information for you to access and reach out to us. And also our website is accarealliance.org. But you can reach out to me directly at 510-427-4624. And of course, there is my email address also, and that of our program manager. So thank you. I really appreciate your time and this opportunity to share. Are there any questions? I think I'll just go back to Antoinette. If you would like to lead that discussion, Antoinette, for Q&A, we will certainly happy to engage in those questions.
Thank you so much, Reverend Cynthia, for a fabulous, full of information presentation. ACCA is really on the cutting edge of helping people to, and families, helping individuals and families on how to make considerations for their future and their health care, and really get everything that they need for end of life planning. And I'm just grateful that we've had the opportunity for you to come and explain everything, Reverend Cynthia. I'm going to check in the chat to see if there's any questions. I was actually typing a question. Could you please, once again, just inform everyone on how to refer someone? Do they have to be a member of a church, or can you explain that?
I'm happy to. No, so you do not have to be a member of any church. You simply need to be an individual that's, number one, either a caregiver or an individual that's dealing with a serious chronic illness and you'd like some support. And the way that you can reach us is, I will put that in the chat actually, so that you can either copy it and paste it or make note of it.
Mhm. Great. The other thing that I would like to see is for you to, at some point, be a guest at the Council for Age-Friendly Communities. I see that Sister Shakura Shani Reynolds is with us this afternoon, and she is one of the administrators with the Alameda County, with the Council for Age-Friendly Communities. And I think that everyone on that council has their finger on the senior community here in Alameda County, the entire county. So it's good to be able to educate the council on what ACCA is doing. And so I would definitely recommend that Sister Shakura would be able to facilitate that with you, Reverend Cynthia.
I would absolutely love that. That would be wonderful.
And that's no problem. I definitely will. We actually had an equity conversation today with the council. The council meeting ran from 9 to 12 today, so I do apologize for being a little late. We had some follow-up after the call, just a brief meeting after the call. But we definitely had our first equity discussion today, and we brought an article to the group on the Latinx community. But we definitely plan to hold a spot on our agenda in every meeting to just talk about the inequity issues that are out there in different populations. And the council is definitely open to suggested readings or suggested presenters and speakers to come and speak on behalf of some of the populations and communities that are experiencing health inequities, food insecurities, so on and so forth, and then to work around resources and aids to help in those areas. So I really enjoyed the discussion today, and I will definitely bring that back to Ms. Faith Antoinette.
Thank you. I sit on this council, but I wasn't able to be there today in preparation for this presentation. But it's a great council. Thank you for all the work that you do, that we are doing together, because we have to do this all together. So, are there any other questions? Thank you so much, Ms. Maxine Hickman, who's the president of the National Coalition of 100 Black Women, for co-sponsoring this event. And please look forward to January 2021. We'll be having another presentation on the on how probate works and all the ins and outs of it, and everyone needs to know about that as well. So we will continue to strive to make a difference in the community and stop this atrocity of elder abuse. Please spread the word, take care of each other, love each other, and thank you for attending. And thank you, Reverend Cynthia, again.
It's my pleasure. Thank you, Antoinette, and continue doing the great work of senior advocacy in our communities. We need all the partnerships and support we can get to really undergird and support one another in a special way. And happy Thanksgiving, everybody.
Happy Thanksgiving. Blessings to everyone.
Bye-bye.
Bye-bye.